This is dissection table number 1. Today we are discussing about the muscles of the back of the cadaver. The first one is a trapezius muscle. The origin of the trapezius muscle is medial 1/3 of a superior knuckle line, ligamental notch, external occipital protuberance, spines of C7 to T12 vertebra. And insertion of the trapezius muscle is lateral 1/3 of the clavicle, medial margin of the acromion process, and superior margin of the spine of the scapula. The nerve supplied to this muscle is spinal accessory, C3, C4 spinal nerves. Actions of this muscles is upper fibers act with levator scapulae and elevate the scapula. Middle fibers act with rhomboids and retract the scapula. Upper and lower fibers act with serratus anterior and rotate the scapula forwards around the chest wall. Now let us discuss about the deltoid muscle. The origin of the deltoid muscle is anterior fibers, anterior border of lateral 1/3 of the clavicle, and medial fibers, acromion, posterior fibers, lower lip of spinous scapula. Insertion of this muscle is deltoid tuberosity of humerus. Nerve supply is axillary nerve. Actions of this muscle is anterior fibers helps in flexion and the medial rotation of the arm. Now let us discuss about the supraspinatus muscle. The origin of this muscle is supraspinatus fossa, and insertion is great at tubersal, and the nerve supply is suprascapular nerve, and which helps in the action of initiation of abduction of the arm. And the next muscle is infraspinatus. The origin is infraspinatus fossa. Insertion is great tubersal. Nerve supply is suprascapular nerve, which helps in the lateral rotation of the arm. And now let us discuss another muscle, levator scapulae. The origin is a transverse processes of a C1 to C4 vertebrae, medial border of the scapula up to the root of spine, and dorsal scapular nerve C3 to C4 fibers, which helps in the action. And the next muscle is levator scapulae. The origin of this muscle is transverse processes of C1 to C4 vertebrae. Insertion is medial border of the scapulae up to the root of spine. Nerve supply is dorsal scapular nerve, C3, C4 fibers, and the actions of this is elevation of the scapula. Next muscle is a rhomboid minor. The origin is ligamentum notch and spine of C7 and T1. Insertion is root of spine. Nerve supply is a dorsal scapular nerve C5, and action is retraction of the scapula. And next muscle is a rhomboid major, spines of T2 to T5. Insertion. The next muscle is a rhomboid major. The origin of this muscle is spines of T2 to T5. Insertion is the medial border of scapula below the root of spine. Nerve supply is a dorsal scapular nerve, and action is retraction of the scapula. The next major muscle is latissimus dorsi. The origin of this muscle is iliac crest, thoracolumbar fascia, spines of T7 to T12 vertebrae, lower 3 to 4 ribs, and inferior angle of scapula. And the insertion of this is fibers twist upside down around the lower border of the teres major. Inserts a floor and a bicipital groove. Now let us discuss about the another muscle, teres major, and the origin of this muscle is lower 1/3 of the dorsal surface of lateral border and inferior angle of the scapula. The insertion of this muscle is medial lip of bicipital groove of the humerus, and the nerve supply is lower subscapular nerve C5 and C6, and which helps in the action of medial rotator, adductor, and extensor of arm. Now let us discuss about the another muscle, teres minor. The origin of this muscle is upper 2/3 of the dorsal surface of the lateral border of the scapula as a two slips, and the insertion is lowest impression on the greater tubersal of the humerus. Nerve supply is axillary nerve C5 and C6. Action is lateral rotator of the arm.